Hello, I'm Dr. George Mollayess. I'm a retina surgeon and ocular oncologist. I work in Lebanon, and I'm assistant professor in clinical practice at the Lebanese American University Medical Center Hospital in Beirut, and head of department at Monla Hospital in Tripoli, Lebanon. Today, I'm going to talk to you about the coronavirus COVID-19 and the risk on the eye, mainly. I'm going to start with telling you how and the way coronavirus COVID-19 gets transmitted through the eye, and if there is a possibility of transmission, and then go on to recommend patients with what to do, and the recommendation to our colleagues in ophthalmology, and to see if the new treatment has any effect on the eye. Since the start of the COVID-19 pandemic in Wuhan, China, we do not know exactly the way of transmission through the eye. Several studies has been done, but it's still controversial. The proposition is that the transmission might be through the droplets, through salivary droplets from an infected patient talking to you, and then if a droplet gets into the eye, it gets to the conjunctiva and now into the body. The other proposition is through the nasolacrimal duct of an infected patient. It goes through the nose, then the duct is connected from the nose to the eye, and it reaches the eye and causes conjunctivitis or inflammation in the conjunctiva of the eye. The third proposal was the COVID-19 virus, the coronavirus. It affects the lungs through the angiotensin converting enzyme 2, and this is found mainly in the lungs, but it's found also in the eye. Some propose that since it's found in the eye, it can cause infection in the eye, causing conjunctivitis. However, the ACE2 level, the angiotensin converting 2 enzyme level, is only found in the posterior part of the eye, in the aqueous humor, in the retina, but it's not found in the cornea or the conjunctiva. So it's still controversial. Several studies have taken PCR swab of the conjunctiva, like we take it to the cotton tip, and do a PCR test to see if the COVID-19 virus is there. But some studies did not detect it. However, others detected it. So at the end, we can conclude that it's still controversial. We need several more studies, more samples to make sure of this. In a study from Hubei in China, they presented it at the JAMA Journal. They showed that patients who had conjunctivitis and ocular symptoms showed more severe pneumonia, and they were more affected by the coronavirus than other patients. So we should always consider the eye as a route of transmission until proven otherwise. As several patients who started with conjunctivitis without systemic disease ended up having a severe pneumonia. Also, in that paper, in the JAMA study, in the JAMA Journal, they showed that patient who has conjunctivitis or ocular symptoms had more white blood cell count, increased neutrophil count, increased procalcitonin levels, increased CRP and lactate dehydrogenase. And this can be a marker for us. So patients who present with conjunctivitis and with positive COVID-19, they should be assessed more precautiously for their systemic disease. So if a patient presented to us with conjunctivitis, what I would do, I would take this seriously. A patient who presents to the clinic with conjunctivitis in this situation, with the presence of coronavirus worldwide pandemic, I would ask several questions for this patient and ask about the systemic symptoms. If he has flu-like symptoms, fever, sore throat, dyspnea, decreased breathing. If he has a family history of contact with anybody with COVID-19 or recent travel, I always ask this to all the patients. And if any of this is positive, I would refer for testing for PCR and for internal medicine. Recommendation for soft contact lens wearers. Since we said it's still controversial. However, I recommend my patient to stop wearing contact lenses because contact lenses, as we all know, there is risk of transmission of viruses or bacteria, especially in patients or who do not take good care of the hygiene, how to handle contact lenses. So, and in patients who wear monthly contact lenses, they should be more alert than those who wear the daily contact lenses. And I prefer both of them not to wear them anyway at all, to wear eyeglasses. And in case you wear eyeglasses, it's always better not to touch the glasses and contact with them because you're close to the eye, to the nose, and to the mouth. So there is a risk of transmission. So it's preference to wear eyeglasses, but not touch your face at all. If you want to move your glasses, just move them from behind and wash your hands always. My recommendation to our colleagues in ophthalmology, because we take good care of patients and we are in close contact with them, is to use the personal protection equipment if possible, the PPE, and see only urgent cases. There's no need to see elective cases or cold cases. Elective surgeries and laser treatments should be deferred for this time being. Only urgent cases. Patients who have open globe, they have trauma, they have eye pain, glaucoma, acute angle glaucoma, only urgent case, retinal detachments, who need urgent care. Always tell patients how to do hand hygiene and face masks during the clinic hours, spacing patients during clinic more than 1.5 2 meters away. Always do awareness, especially in the third world countries. Try to triage patients as much as possible. The last thing I want to say is about the treatment for COVID-19. We all know it's still not by protocol, but now most of the people, most of the doctors are treating it with hydroxychloroquine or chloroquine, with high dose of these two medications. However, we all know that chloroquine or hydroxychloroquine can affect the retina. However, and this over a time of 2 weeks, it's still controversial. And our recommendation right now is like we can go on, and there's no need to screen patients to screen patients for the retina, as this dose might not be so toxic because it's the cumulative dose of chloroquine that affects the retina. However, we should always be cautious. If any patient presents with any eye problem or decreased vision, blurry vision, eye redness, we should always be there to take care of the patient. I hope this presentation was good and informative, and I'm here for your questions. Thank you.